Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about the denial codes and remark codes in our medical terminology. So here the concept we have to understand that if a medical claim is submitted to insurance companies will receive the claim from the doctors or doctors offices, and after that they will process that claim. After process they will finalize the claim. After finalize they will give the conclusion that we will give the payment to the doctor, or otherwise we will give the denial to the doctor's office. So generally if they are giving the payments to the doctor also, we can see some kind of code. And but mostly whenever the denial is there, if they are not providing to the payments on a claim, then they nothing but insurance will give the reason why they are not giving the payments to the doctors. That reason might be anything. So we have to understand that this reason will be given by the insurance in the form of codes. That codes are nothing but denial codes or remark codes. So denial code is nothing but they are telling why it was denied. So they will give the reason why insurance is not giving the payment, why they are denied the claim. And the remark code is telling about additional reason why this claim was not paid by the insurance and what they are looking exactly. So this is what we have to understand the denial codes and remark codes. Here generally the denial code is known as a CARC codes, nothing but claim adjustment reason codes. And the remark code is known as a RARC, is nothing but remittance advice remark code. But in simple you have to understand that denial code is nothing but the reason why they are not giving the payment to the doctor, they will provide on a denied OB. And RARC remark code is nothing but exactly what reason they are, exactly what thing they are looking to I mean exactly what kind of thing are required by the doctor, are required by the entities to process the claim. That thing they will provide on a denied OB. So insurance is giving these two codes. By these two codes we can understand that why it was denied. Simply you have to understand this is the concept. And next we will discuss exactly what kind of examples codes are there, we will discuss in this video. And before that guys, if you are watching our video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon, I mean turn on the bell icon, so that you will get every our video as a notifications to you. Guys, now we are discussing about CARC codes, nothing but denial codes, claim adjustment reason code, generally it will be called. These codes are issued by the payer or insurance companies and explain why a claim was not paid by the insurance, I mean not paid to the doctor. So these, they are standardized by the organizations, and these codes generally used by the traditional Medicare and Medicaid and also Tricare and some other government insurances also, right? All insurances, government, Medicare, Medicaid, Tricare, these all are the government insurances. And also these codes already also given by the commercial insurances, private insurances. So generally we have to keep in the mind that insurance companies will give these codes, CARC codes. What these codes are explained, these codes are explained why the insurance is not giving to the payment to the doctor. So they are telling in the form of codes. That codes is known as the CARC codes. This CARC codes is telling that why this claim was not paid to the doctor. Simple. And sometimes it's very rare, even claim is paid to the doctor, they will tell that CO45 is a one more code is there, that is telling that it is a contractual adjustment. How much amount doctor can adjust, that amount we can understand that the CO45. But mostly 99 percentage they will give the codes only because of non-payment, nothing but denials. If claim is denied by the insurance, we have to understand by CARC code, because that CARC code is giving the explanation why this claim was not paid by the insurance to the doctor. And that code might be like two letter prefix. Often it will be stands like, for example, CO. I given as a CO here, nothing but contractual obligation. Nothing but provider cannot bill this kind of CO code is there. For example, on a denied OB, that kind of prefix of a two letter CO is there. We have to understand that that is related to doctor itself. That is not related to the patient. If CO code is there, if you are billing to patient, that is mistake. That is like incorrect. So that is what I'm telling. That is what I'm telling. So we have to understand these codes are very important. By seeing this code CO, you can understand that that denial is related to doctor. Sorry. And you're coming to PR code. PR is nothing but patient responsibility. Nothing but, if you are seeing this prefix as a PR before the code, then you have to understand this is not related to the doctor. This is related to the patient. But we have to confirm before your any claim which is related to the patient. But we have to clear information that if PR is nothing but patient responsibility. For example, PR1, PR2, PR3, I mean nothing but deductible, co-insurances, co-pays. These are, we can understand that that patient is only liable for this kind, or responsible for this kind of PR codes. And some other code is there, OA. It's nothing but, O stands for other and A stands for adjustments. So other adjustments, if there is any adjustments are there, for example, we are can see this like PP max scenario. For example, primary paid more than secondary allowed amount. At the time, this other adjustments is nothing but we have to adjust that balance, right? So I think if you are not aware, if you are watching this video first time, could you please refer other videos in our video, I mean in our channel. I already explained the denial PP max also. You can understand directly. If you are watching, okay, you, it is a very new to understand these terminologies. But simply you have to understand that OA is nothing but other adjustment. Coming to PI, it is also code, I mean two letter prefix before the code. A PI is indicated nothing but payer initiated reductions. So we have to understand that it is a payer initiated. So by name we can understand that it is related to the insurance, or it is not related to the patient, we can understand. But it is related to insurance. Generally when we can see nothing but, for example, insurance is denied like timely filing. Some insurances telling CO code, and some other insurances will telling PI code. But it is a related to specific to that payer. uh, that payer is giving terminology like PI. We have to understand that it is a payer initiated reductions. So why means we can understand by seeing the code. So we have to understand that simple CARC code are nothing but they are explained why insurance is not giving the payment to the doctors. Now we will discuss what are those codes in the next slide. Before that, we have to understand that if CO is there, it is related to the provider. PR is there, it is related to the patient. OA is there, for example, you have to understand that we can do adjustment on these claims. If PI is there, nothing but also approximately related to the CO. Nothing but it is related to the insurance and doctors, but not patients. Okay, we have to understand this basic uh, terminologies on a medical denied EOBs or medical paid EOBs also. For example, CO45, whenever the doctor paid amount is there, CO45 is there, we have to understand that claim is paid. So in that we have to understand whenever claim is paid to doctor or denial is given to the doctor, then we have to understand this kind of prefix letters are there before the denial codes on a denied EOBs. Okay, now we will discuss about claim adjustment reason code, CARC code examples, nothing but denial code examples. Here I given very common denial codes, CARC codes. Example 1, CO16. So whenever a medical claim is submitted by the doctor or doctor's office to the insurance company acknowledge that claim. After that they will adjudicate. After that they will process that claim, and finally they will denial. They finalize the claim to final statement is nothing but and that claim is denied. They are not pay any payments to the doctors because of so and so reason. Here the reason code on a denied EOB is telling as a CO16. Example 1 I given. That CO16 is telling that service or procedure or a claim lacks information or as something submission error or billing error. They are telling that okay, you have your billing error. You are not submitted the claim as per billing norms. As per submission, you are missing some information. What information we don't know, but they are telling that okay, you are missing some information. That is the beauty of CARC code. The code is telling doctor that you are missing some information. By seeing this code, we have to understand that this is not related to the patient. This is related to the doctor. Doctor is not submitted in a correct way the claim to the insurance. So that is we have to understand by seeing this CARC code. Coming to other example, CO288 referral is absent. So the medical claim is not paid to the doctor because of the reason CO288. Nothing but referral is absent. Referral is not available on a claim form. So that is what we have to understand by seeing the denial code. For example, one more code I given PI204. Nothing, PI I already explained, right? Payer initiated. CO contractual adjust obligations. So here PI is 204 is telling that the service, whatever service or treatment or drug or equipment, we can call it, terminology is like that in medical. So whatever the service, whatever the treatment or whatever the equipment or a drug which is not covered under the patient current benefit plan. So we have to understand that if you are experienced in medical terminology, you can also know that sometimes some insurances also will given as a PR 204 also. So if it is a patient responsibility, they will give PR 204 directly. They are concluded that it is related to the patient. You may bill to patient or other entity. If other insurance is there, okay, you can bill it. Not otherwise, then it is not related to the. It is related to the payer. So if we have to understand that it is a PI 204, nothing but service or drug is not covered by the patient current benefit plan. And some other thing is CO45. Charges exceeds fee schedule or maximum allowable or conducted legislated fee arrangements. So nothing but whenever this code, it's very important, whenever the claim is paid 99.99 percentage, we will use this code. If claim is paid to the doctor, we will see on a paid EOB CO45. Nothing but whatever the paid amount is paid, paid amount is paid to the doctor, the leftover amount is adjustment as per contractual arrangements or contractual fee arrangement or as per contract between the doctor and insurance. Whatever the leftover amount is a nothing but adjustment. So by seeing this CO45, we have to understand that the claim is paid to the doctor. If paid amount is there, we can adjust that remaining amount as a contractual adjustments. Okay, coming to PR96, it's a non-covered charges. So here insurance is telling that patient responsibly, whatever your billed charges are responsible to the patient. So by seeing this CARC code, we can understand that this kind of charges are not covered by the insurance. And some other thing is OA258, other adjustment I told. So it's a 258 is the code or CARC code. This code is telling that the claim or service or treatment, whatever, not covered by the insurance when patient is in the custody. Whenever the patient is in a custody, at the time, whatever the service given by the doctor, that service if billed to the insurance, then insurance is not giving any kind of services. Not covered any kind of services whatever billed by the billed by the custody services by the doctor. So simple, whenever the patient in a custody, insurance will not cover the services. How we can understanding by the beauty of this CARC code, we can understand and conclude that this is the reason of the claim. why it was not paid to the doctor. So in that way, CARC codes are useful to understand the reason why it was not paid to the doctor. Okay, we already discussed about denial code. Now we will discuss about remark code. So here remark code is nothing but it is giving additional information to the denial code. So denial code we will know that, for example, service lacks information. CO16 is there. What information is required exactly to process the claim? That will be given by the remark code. Remark code is nothing but it is a additional or supplementary information about uh, denial. So whatever the denial is there, why it was not paid, we understand by seeing denial code, CARC code. But additional information is there, why it was why it was denied by the insurance. So what exactly information is known by the RARC code. That is why most of the people are looking for the remark code. Even denial code is there, remark code is there. Which is the priority? Remark code is a priority. By seeing remark code, we can find out exact potential cause of the claim. So why it was not denied, okay, they will give the denial code. And also in addition to denial code, below we can see one more code, it is called as a remark code. That remark code is telling additional information or supplementary information or potential cause of information, exactly why it was denied, that will be give that information will be given by the RARC code. That will be known as a remittance advice remark code. It is a remark code. Already we know that reason code is a CARC and RARC is a remark code. And while the CARC gives the reason for adjustment, the RARC gives additional context for the denial code. RARC format is alphabetical and numeric. For example, EN30, nothing but patient ineligible for these services. So in that way, we have to understand that RARC code are useful in addition to the CARC codes. Okay, now we will discuss about few examples of RARC codes. Remittance advice remark codes. Please keep in the mind that the CARC codes, RARC codes are always available on a denied EOBs. So especially the RARC codes only available for the denied EOBs. But CARC codes available on a paid EOBs also. Paid, for example, claim is paid some amount to the doctor, and the whatever leftover amount is a contractual adjustment amount, then CO45 code is available. But if claim is paid to the doctor, then there is no RARC code. If you are good at medical or US healthcare department, you can understand this concept. So I'm telling is RARC code is not available on a paid claims. Okay, so we will discuss about few examples of a RARC codes. I already we already know that denial code CARC, for example, CO16 is there. They are telling that service lacks information. At the time, if the remark code is not there, we are not sure what information is required to process the claim. What information is lacks of information? I mean, what kind of lacks of information is they required? We don't know. At that time, under CARC code, there is a RARC code. They are telling that EM76. Example, I am telling. So I'm not telling here exactly for the denial code of CO16 we will get a MA 76. It might be to the any denial code, but example I am telling that if you are getting some CO16 denial, there might be chances to getting remark code EM76. So based on medical diagnosis and treatment, the insurances will give the denials to the doctors. So we are not sure that for that denial code you will see only that kind of remark code. It might be anything. A reason is different and remark is also different. That is what we have to understand. So before that, we have to understand it as telling about additional information, incomplete or invalid diagnosis code for M76. And we have to understand that here M119 also I given one more uh, remark code. This is telling about national drug code need. National drug code is need. Just 1 minute, please. So national drug code is need. So for example, if Remark code M119 is telling that NDC code is missing or required to process this claim. If the denial code is CO16 and the Remark code is M119, we have to understand that drug code is missing. So for example, if denial code is CO228 missing referral, they are additionally give one more Remark code clearly telling that missing referral form. Referral form is missing. So in that way we can understand that okay, form is not submitted, referral form is not submitted to the insurance while submitting the medical claim form. So that is what, if you, the next time what is the corrective action, we have to submit the uh, uh, referral form. So by seeing this remark code, we can understand the potential cause of the claim. So whenever the CO45 is there, and yeah, this is MEA 18 is like, whenever Medicare process the claim and paid the claim to the doctor, they will give CO45 code along with MEA 18. This is also one more thing. Whenever the paid claim, uh, there is a remark code MA 18, we have to understand that this claim unpaid, we will see this MA 18, it's telling that this claim is sent or forwarded, I mean this claim are crossover to the supplementary insurance. If patient have a alternate insurance, then Medicare automatically transfer this claim to the supplementary insurance. At the time we can see MA 18. So here, keep in the mind that MA18 is not a denial code. It is whenever the claim is paid, they are telling that this information is cross out to the supplementary insurance. So if the patient have a supplementary Medigap insurances, then traditional Medicares, this code is only at the insurance is having Medicare as a primary. Okay, coming to N130, review plan benefit doctor information. So here they are a plan benefit doctor information is required, and N34 is nothing but incorrect claim form is used by the I mean whatever the format, whichever format is used by the doctor. At the time we will getting this denial of a remark code. Here N570 missing or incomplete invalid credentialing data. So here whatever the data which is required by the credentialing is invalid. So here we have to conclude that simple, there is a remark code is nothing but it is a giving exact potential cause of the claim. So additional or supplementary information of a denial code is explained by a remark code, we have to understand. Okay guys, these are about the remark code and denial codes. So we have to understand that these codes are useful to identify the potential cause of the claim, nothing but why claim was not paid to the doctor. So by seeing this denial codes and remark codes, sometimes calls also not required to the calling to the insurance. If you are good at analysis, then you can close this claim if you are good at understanding of reason codes and remark codes. And guys, if you felt the content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And thank you so much for your time. Have a good health. Bye for now.